Why, after taking fatty meals, patients with gallbladder stone often complains of pain? Patients with gallbladder-related pathologies often feel excruciating pain after taking fatty meals. What is the connection between fatty meal and like pizza, burger, or French fry? Taking this kind of greasy fatty foods and the increased pain in a patient with gallstone. What is the connection between fatty foods and biliary colic? We try to understand it here. Now, what happens that, let's say you went to a fast food center or you ordered some food from a fast food center, like foods like pizza, burger, these oily, greasy foods. And you take them, these foods first go into your oral cavity, then into esophagus, then into stomach, it gets semi-digested, and that semi-digested, oily, greasy food now comes into your duodenum, where actual digestion occurs. Now in that duodenum, in the wall there is a cell, some cells are there, these cells are called eye cells. And eye cells have some property to release hormone. It releases a hormone called cholecystokinin. So cholecystokinin. My name is cholecystokinin. My parents named me cholecystokinin because I cause kinesis, movement of chole means bile, the cyst means sac. That means I cause movement or contraction of the sac where the chole or bile is stored. So cholecystokinin basically causes contraction of the gallbladder where the bile is stored to release bile. So this cholecystokinin hormone is a kind of signal that your food has entered into the duodenum, small intestine, fatty food, and now it needs the help of bile for digestion. We all know that one of the key function of the bile, which is synthesized by the liver and stored in the gallbladder, is to help in lipid or fatty food digestion. So the body needs to send a signal to the gallbladder, because how do the gallbladder know that I need to contract and I need to release the bile? So that is happening through this signal, this hormone cholecystokinin. So now let us come to the point that fatty food has entered into your small intestine and eye cells release the cholecystokinin. Now this cholecystokinin, it's a hormone, through the blood, it would come and it would try to contract the gallbladder. Now, let's imagine a patient has gallbladder stone, and this gallbladder stone is obstructing, let's say, neck or the cystic duct. Now, this gallbladder is trying to contract against this obstruction, because normally what happens? Gallbladder can smoothly contract and the bile flows from the gallbladder through, they come to the cystic duct, they come into the common bile duct, and then they reaches into the duodenum. This happens normally. But if a patient has some stone in the biliary tract, it has stone in the cystic duct, or it is stone in the common bile duct, what is happening? The bile cannot come from the gallbladder into the duodenum because there is an obstruction. This stone is causing a mechanical obstruction in the pathway. So that, then what would happen? The pressure would build up, and there would be boom. There would be this increased pressure would cause the biliary colic, because now the bile cannot come from the its stored place gallbladder into the duodenum. So that is the basic connection between fatty food and the biliary colic. The fatty food accentuates. So that's why the patients with gallstone or biliary pathologies, they often complain the food is, the pain accentuates, and they often feel excruciating pain after taking the fatty meal. This is the connection. Because the connection, the hidden connection is cholecystokinin hormone, which once the fatty food enters into the small intestine, particularly the duodenum, from the duodenal wall cells, eye cells, a hormone get released. That hormone is cholecystokinin. Kinin means movement, chole means bile, cyst means sac. So it causes movement or contraction of the sac gallbladder, which stores the bile, cholecystokinin. That means it causes contraction of the gallbladder. And as the gallbladder contracts against a mechanical obstruction, because the bile cannot flow, it raises the pressure there, and it can sometimes even cause this pressure, increased pressure can cause ischemia in the wall of the gallbladder. It can further accentuate the pain, you understand. So these things, this is the basic reason that this mechanical obstruction by the stone is impeding the free flow of the bile from the storage place in the gallbladder into the duodenum. That is basically the cause, the connection between fatty food and the patients with gallstone, cholelithiasis, they often experience the pain, or gallbladder pathologies having the pain. I would continue this gallbladder pathologies in the further sessions also, because there are many exciting things to share here. Thank you so much.